Next, we're going to be doing a hip roll up. It's similar to a glute bridge, but instead of moving as one piece, we're going to articulate through each vertebrae of the spine, one after the other, to really find any stickiness in the spine mobility, and also to find our deep core as we move into that extension. So while you're moving, I want you to think about all of our spinal vertebrae stacked and then moving one on another through the movement. Bent up. You want to make sure that you're stacked enough so that when you come up, your knees are not going over your toes. So this is not great. So we want to stack so that as we come up, our knees are in line with our ankles. So find a position that works. Make sure toes are forward, hip distance apart, knees are hip distance apart. And we're going to start in that neutral pelvis. Take an inhale to start and let everything relax. Let our pelvic floor go. Let our abdominal muscles relax. And then as we exhale, we're drawing those 4 points of the deep core towards each other. And then when they're fully drawn together and we're really engaged, we can start peeling tailbone off the floor. And then low back, mid back, pressing through the whole feet all the way up until their last rib peels off the floor. Take an inhale here. As we exhale, rib cage comes down first, then mid back, low back, and finally tailbone. So we're really moving one vertebrae at a time to feel if there's any stickiness. I'll show you another one. Inhaling, exhaling, find your core, peel tailbone, low back, mid back, bottom rib cage. Keep rib cage tucked in, lower down. Mid back, low back, tailbone. Watch for any rib cage flaring. I'll show you what that looks like. When we come up, are we coming down like this with our rib cage flared and trying to come down here? See if we can keep rib cage tucked in as we lower. Also look if you want to lift toes, fall out with the knees, fall in with the knees, and try to keep everything aligned as we move through this.